All right, guys, the next part in the chapter is 2.4, unit 2.4, and it's health insurance plans. Woo, exciting health insurance plans. I know you're probably like, yay. All right, but it does have some important information that you need to know. Okay, so first of all, I'm assuming that most of y'all have health insurance. You just don't know it, or you don't talk to your parents about that. I mean, why would you? You're teenagers, and why would you go asking your parents about, hey, what kind of health insurance do we have? But it is something that you can impress your parents on after you watch the video today and you watch the videos that I put up and you read through your notes. You can go ask your parents about different things like, hey, do I, Bill, you can go ask your parents like, hey, do we have a, what is the name of our health insurance plan, and do we have deductibles and co-insurance and that kind of stuff, if you want to kind of impress them. So, first off, health insurance plans, people have different ones. I personally have Blue Cross and Blue Shield. Some people have Humana, some people have United Healthcare, some people have Aetna. There's like tons of different health insurance plans, okay? If you're reading through the notes, and I keep glancing over here because that's where I got the notes at, okay? If you look at it, it tells you everybody has different insurance plans, and they cover different things. Like mine may cover for me to get an MRI of my MRI if I needed an MRI of my neck, or a CAT scan or something. But John down the street may have a totally different health insurance plan, and they may not cover MRIs. So everybody's health insurance plan is different, it costs different, and it covers different things. Most of them have what is called a deductible, okay? And that's, consider it like a vocabulary word when you're looking at your notes. You might want to underline it, start, because you do need to know, what a deductible is. It says the amount that must be paid by the insured person for medical services before the policy will begin to pay. So not everybody has a deductible, but some people do. We personally, I think we have like $1,000 deductible. So what does that mean? So we have 1,000, so we'll just say we'll just make up numbers, okay? So let's just say that I have $1,000 deductible. I go to the doctor and he orders blood work for me, right? So one of our little healthcare facilities could be the lab, right? And I go over to the lab to get my blood work done. And the phlebotomist, that's the one who draws your blood, says, hey, you can get this blood work done, but it's going to cost you $200. The total cost for the blood work is $200, and you have $1,000 deductible. So your insurance is not going to pay anything until you meet that $1,000 deductible. So basically, I am out $200. I'm going to have to pay $200 for my blood work, okay? So remember, our deductible is like $1,000, right? So if I pay $200 here for this blood work, later on down the road, I go get some other test done, it's another $200 or $300, whatever it is. Once I reach that $1,000 mark, then I'm good to go. Then my deductible is met. Then my insurance company will start paying for things or start covering things, okay? But until I meet that deductible, they're not going to cover anything. Hopefully that kind of makes sense. And you can watch the little video I post too. All right, so just remember that amount that must be, so if you read the definition, the amount of money that must be paid by the insured person, which is me, I'm the insured person, for medical services, my blood work, for example, right? Before the insurance policy is going to pay anything, that's a deductible. Okay, then you have co-insurance. All right, co-insurance, it says requires that specific percentages are shared by the individual company, between the individual, which is myself, and the insurance company. So say I don't have a deductible, because not everybody has deductibles. So just put deductible out your mind. I don't have a deductible anymore. Okay, I don't have a deductible. I go to the doctor and they say, hey, your blood work is $200. The insurance is going to cover your co-insurance. The insurance is going to cover 80% of it. You're responsible for the 20% of the $200 is what I would have to pay. Okay, so when it talks about percentages is co-insurance. Okay, typically it's 80-20. The insurance pays 80% and the person or the patient pays 20%. You have copay. Copay is the specific amount of money the patient pays for a particular service. You ever go to the doctor, to the pediatrician, and you ever notice mom or dad or whoever's taking you, they pay money. Sometimes it's $25. Sometimes they don't pay. And sometimes they may have to pay $25, $35. Okay, that's a copay. That's the amount of money that the patient has to pay for a particular service, regardless of the total cost of the visit. So like if I have, I know right now, if I get out my insurance card, I think it says for office visit, it's got $25. So if I have a sore throat and I go to the urgent care over there by Sunray, I know before I even walk in the door, my co-payment is $25. I'm gonna have to pay them $25 before they'll even call me to the back. That's my co-payment, Okay, so you have deductibles, co-insurance, and co-payments. Just kind of look over those. If you have any questions at all, let me know, and we'll talk more about it when we come to our Google Meet on Friday at 1 o'clock. We'll kind of go over those again. Okay. If you're going on through, there's some stuff that I did not highlight in the notes. If I did not highlight it, the blanks, don't fill that out. Just move on. Okay. You need to know the difference between Medicare and Medicaid. Bottom line, I put a video up there, but you've got to know the difference between Medicare and Medicaid. I'm sure you've heard of both of them, but you probably don't know there's a difference between the two. All right, Medicare, we like to think of Medicare, cares for the elderly, 65 or older. If you're 65 or older, you qualify for Medicare. Basically, it's a government insurance, and the government, will pay for your health insurance. Okay, they're sponsored by the government. All right, so Medicare, if you want to think of Medicare, they care for the elderly, that's 65 or older. Okay, there are three different types of Medicare. If you read it, I'm looking over at the notes, and yes, you got to know the three different ones. There's Medicare Type A, Medicare Type B, and Medicare Type D. They skip C, I don't know why. Okay, so Medicare Type A, B, and D. All right, Type A is for hospital visits. Type B covers doctor's office visits, and Type D, if you can remember D, drugs, pharmaceuticals, that's drugs. Type D covers for pharmaceuticals or medicines. All right, so Medicare care for the elderly, 65 or older. Three different types of Medicare. There's Medicare Type A, Type B, Type D. Type A is for hospital services. Type B is for doctor's office visits, and Type D is for pharmaceuticals or medications, or if you think D, drugs. Okay, that's something that we would, as a class, we would have gone over and over that until the kids were like, we got it. Right, so Medicare, care for the elderly, 65 or older. I know your three types. Medicaid is something totally different. Okay, Medicaid has nothing to do with you being 65 or older. That's Medicare. Medicaid, okay, covers individuals that have low incomes, or people that qualify for public assistance, or people that are physically disabled or blind. Okay, so it doesn't matter what age you are, even children can get Medicaid. Okay, Medicare, 65 or older. Medicaid is different. There's no age limit with Medicaid. It's for low-income families. People who are physically disabled or blind can get Medicaid. Okay, and it's all there in your notes. Something else that's different with Medicaid, it depends on your state. Each state has their own rules for Medicaid, meaning I could fill out a form and apply to get Medicaid here, Louisiana Medicaid, and they may say, oh yeah, you qualify for Medicaid, you have Louisiana Medicaid, and then I move to Oklahoma, and I could fill out for Medicaid in Oklahoma, and they're like, sorry, you may have been approved for Medicaid in Louisiana, but you don't approve for Medicaid here in Oklahoma. So each state is different, it depends on the rules. Medicare, care for the elderly, 65 or older, it's universal across the board. Anybody, if you're 65 or older, you qualify for Medicare. Okay, Medicaid is different, it depends on each state's rules. Okay, there's also something on here called Medigap. Okay, Medigap, which is right above Medicaid in your notes. This is people that if they have expenses with Medicare, it helps them pay for that. I don't want you to focus on that too much. I want you to know the difference between Medicare and Medicaid. Okay, and know the three types of Medicare. All right, I also want you to know, if you flip it over, what TRICARE is. TRICARE is for military. If you have any friends that are military, ask them if they have TRICARE. They usually do. So TRICARE is health insurance for military families. It can be survivors, like maybe the spouse has passed away in action or war, or something like that, and the remaining spouse, husband or wife, and their children can still get TRICARE insurance. Survivors, veterans. You don't have to be active duty, is what I'm saying. You don't have to be active duty military to get TRICARE. It can be you can be non-active, and it's also for your family members too. Okay, so you need to know what TRICARE is. It's insurance for the military. What else we got on here, guys? I think that's about it. I do want you to know, if you're looking on your notes, workman's comp. You might have heard of workman's comp if you get hurt on the job. It's right above TRICARE in your notes. If you get hurt on the job, you may qualify for workman's comp. You're working at a grocery store and you're stocking shelves and you slip and fall and break your hip or something. You can apply for workman's comp. You have to apply for it, doesn't mean you'll get approved. You fill out a form saying this is what happened to me, da 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 da. And if you can prove that the grocery store, didn't do what they were supposed to do to keep you safe, then you may get workman's comp, basically where the grocery store would pay your salary and pay for your medical bills and that kind of stuff. So I do want you to know what workman's comp is. That's for if you're injured on the job. Okay, I'll do a video in a minute that's going to be about HIPAA, and it'll kind of HIPAA and organizational charts, and that will wrap up chapter 2. If you have any questions at any time, let me know. Your test is going to be on Monday, and I will see you guys at the Google Meet, hopefully on Friday.